Kia ora. Ngā mihi mahana I te wikirei Māori nei. Warm greetings on this Māori language week. Welcome to the third session of the Leukemia and Blood Cancer New Zealand Patient Forum. My name is Nikki Roy. I'm Support Services Coordinator based in Wellington. Today's session is on the fear of cancer recurrence and managing mental wellbeing with Dr. Philippa Croy. Before I introduce Philippa, just a reminder that you are welcome to send in questions throughout the presentation. You can do this by clicking on the Q&A tab at the bottom of your screen and typing in your question. At the end of the presentation, I will read these to Philippa to answer. It is now my pleasure to introduce Dr. Philippa Croy. Dr. Croy is a registered clinical and neuropsychologist working in private practice in Wellington. Philippa is an experienced clinician who has worked in psycho-oncology for over 15 years. She worked as a research fellow for Marie Curie Cancer Care in London before returning to do her clinical training. She has worked within hospitals across the Wellington region for many years, supporting young children, adolescents and young adults to adjust to life after childhood cancer, and more recently helping adults in their whānau with challenges relating to their cancer diagnosis and treatment. In her private practice, Philippa continues to provide specialist psychological support for people in their whānau throughout their cancer journey. Thank you for joining us, Philippa. Over to you.
Thanks very much, Nikki. Tēnā koutou katoa, ko ingarangi te whakapaparanga mai. Engari ko hakateri te whenua tupu, ke whanganui ātara au e noho ana, he ka mātai hena ngaro au e Mind Talk, ko Philippa taku ingoa, tēnā tātou katoa. Thank you very much, everybody, for joining this webinar today. My name is Philippa Croy. I'm a clinical psychologist in private practice in Wellington, as Nikki mentioned. And I've lived in Wellington for many years, but originally from down south in Canterbury. So today I'm going to be talking to you about fear of cancer recurrence and also about managing just general mental well-being. So I'm just going to get my things all set up. Okay, hopefully all that technology behaves itself. So fear of a cancer recurrence has been defined as fear, worry, or concern relating to the possibility that cancer will come back or progress, and it can take many forms. For those who experience cancer, some degree of fear around recurrence is normal. However, for many, it can have a significant impact on their lives, lasting for many years, and it can influence how a person thinks, how they feel, and how they behave. They may experience constant and intrusive thoughts about cancer and interpret any physical symptoms as signs of cancer recurrence. They can also have high levels of anxiety and distress and overall poorer quality of life. They may avoid follow-up appointments or contact their doctor frequently, undergoing what would probably be considered maybe excessive screening of symptoms. At home, they may engage in frequent body checking and may involve their partners or loved ones in this process or seek reassurance from them. They may be unable to plan for the future, such as going on holidays or starting new projects. Fear of cancer recurrence can range from mild to severe. Those with mild fear of cancer recurrence may experience occasional thoughts, which are triggered by particular events or situations, and can experience anxiety for a couple of days. Whereas those with more moderate to severe fear, they may experience more frequent and intrusive thoughts and have a perceived inability to control these thoughts and experience high levels of distress. How common is it? Well, it's estimated that between 40 to 70% of cancer survivors experience a level of fear that is long-lasting and quite debilitating. A recent systematic review, which looks at a large number of studies, found that 59% of cancer patients and survivors had moderate levels of fear, and an additional 19% had severe levels of fear. One study that found that 53% of hematology cancer patients had clinically high levels of fear, which was higher than found in previous research in other cancer patients. Adolescents and young adults also report high levels of fear, with it ranging from 31 to 85%. And it's not just experienced by patients. Some research has shown that almost half of caregivers report fear of cancer recurrence. And of course, we've been having to deal with COVID over the last few years, and studies have looked at the impact that this has had on fear of recurrence. What they've found is that more patients are reporting fear of cancer recurrence since COVID compared to beforehand, and it's sort of sitting at around 86%. One study found that among hematology cancer patients in remission, 95% of people had clinical or high levels of recurrence, fear of recurrence, which is almost nearly all patients. And the two top things that were found to be associated with that fear was distress and concern about the impact of COVID on cancer management. Oops. There are often particular triggers or events that can increase anxiety. Some typical examples are new or changes in physical symptoms, particular dates of significance, such as the date of diagnosis, the media, what we hear on the radio, what we see on TV, what we look at online, seeing ads or documentaries. These can be quite triggering for people. Follow-up appointments, tests or scans can also be very anxiety-provoking. Hearing about people's new cancer diagnoses or recurrence. So it can be helpful to just be aware that at these times an increase in anxiety is going to be normal. Several potential risk factors for fear of cancer recurrence have been looked at. There's a lot of mixed views about things, but the two that have consistently come forward is that women and younger patients are more likely to report it. There have been a number of theories about fear of cancer recurrence. Early models have suggested that people are more likely to experience fear of cancer recurrence if they have a high emotional response to cancer, or they believed that their cancer was more severe, long-lasting, and out of their control. More recent models have sort of built on that idea. One model by Fardell et al. Has suggested that some people develop sort of unhelpful thinking styles that can increase their fear of cancer recurrence. They might believe that worry will protect them. So they might go, worrying helps me prepare. Or they might think that the worrying actually causes harm. Worrying too much is going to make my cancer come back. Or they might feel like it's uncontrollable. I can't make these thoughts go away. They tend to ruminate and focus their attention on themselves and their symptoms, and can become hypervigilant to perceived threats. They then try and suppress, control, or avoid worrying thoughts about them. And unfortunately, all these behaviours can actually make their fear worse. The fear of recurrence can also be exacerbated when people have insufficient or inaccurate information about the risk of recurrence, or they have other challenges that they're having to cope with, such as prior losses, or have had mental health difficulties. As more people are surviving or living with cancer, there has been an increase in people's awareness of fear of cancer recurrence over time. Unfortunately, it is still one of the most common unmet needs reported by people with cancer. So looking after your mental well-being is really important, and there are many things that you can do. A cancer diagnosis can leave many people feeling a sense of loss of control in their lives, whether it's about their diagnosis, their treatment, or the side effects of treatment, their response to treatment, changes in their body, and Uncertainty is something that a lot of people find really difficult to cope with. So being able to focus on what you can control can be really helpful. Things like who you spend time with, who you listen to, how you care for yourself, how you speak to yourself, what you do, and what you focus on or put your energy into. Even if there's something that you can't control, realizing that you actually still have the power to decide how you respond in that situation can be helpful. For example, not having control over whether new symptoms show up or not, but having control over how you deal with them. You can have the choice to ignore them or avoid them. You can have the choice to worry about them, or you can choose to actually seek advice and talk to your doctor about them. In this day and age, we can easily access huge amounts of information. It's really tempting to Google or read blogs on Facebook, posts about other people's experiences or their opinions about things. While there is research out there about the pattern of recurrence for many types of cancer, no one can tell you exactly what will happen in the future. Your oncologist or other healthcare professional who knows your medical history can tell you about the chances of it recurring. They can also tell you what symptoms to look for. Learning about the meaning of symptoms and those likely related to recurrence can be helpful. Knowing what to expect may help you stop worrying about that every ache or pain means that the cancer has come back. Ask about what steps you can take to reduce your risk of recurrence. Discuss a follow-up plan with your doctor. Attending follow-up visits, whilst very anxiety-provoking for many, can actually provide you with a sense of control. Have someone with you, let them know how you're feeling. Have something to distract you while you're there. Take a list beforehand of what you want to talk about and plan something nice to do afterwards. Have an understanding of what would warrant contacting your medical team. Is it that you have a new pain or a new symptom, or is it that they get worse? So having an understanding of that can be really important. And know who you can contact if you're concerned. It may be your GP in the first instance, or there may be someone in your medical team that you're able to contact. Ask them who you can talk to if you're worried about cancer recurrence, whether they can recommend any support groups or services that might be able to help. Social support is really important. Keep in touch with family and friends. Find someone that you feel comfortable talking to. Find some people that, some people find it helpful that you can talk to someone who has had similar experiences to them, whether it's an individual one-on-one or whether it's in a group situation. I know groups are not everybody's cup of tea, but many people find them really helpful. They offer a chance to share feelings and fears with people who understand. You can exchange practical information, get helpful suggestions. Groups can also create a sense of belonging that help people feel less alone and more understood. Be aware of how you carry stress in your body. Try relaxation exercises, massage, progressive muscle relaxation. You can do things, oops, I've just realized I've jumped slides. Oh, good. Finding ways to manage stress can help lower your overall levels of anxiety. Try different ways of reducing stress to find out what works best for you. Make time for yourself. Doing what makes you feel good. Maybe it's spending time with friends, it might be surfing the internet, going for a walk, or doing some exercise, or watching your favorite movie. If you aren't sure what makes you happy, start looking for some new things that you might like to try out. Be aware of how you carry stress in your body. Do you get a tight feeling in your stomach? Are your shoulders tense? As I mentioned before, relaxation exercises, massage, or a technique called progressive muscle relaxation can be helpful. get time each day to do something relaxing. Now, anxiety is one of a myriad of emotions that we experience. And whilst we often categorize it as bad or unpleasant, something to avoid or get rid of, it actually serves a really important function. If we didn't experience any form of anxiety, we'd potentially do all sorts of risky things, pat tigers, eat or drink food that's well past its use-by date. It's known as the fight-flight response. Anxiety is designed to protect us from danger and allow us to react faster in emergencies. I'm sure most of you are familiar with that fight-flight response, but just quickly, we can experience a range of physiological symptoms when anxious. Racing thoughts, changes in our vision, dry mouth, our heart can beat faster, we can get butterflies in our stomach, our hands might get cold or our muscles might get tense, we might feel a bit dizzy or lightheaded. Our breathing can change, it can get quicker or shallower. We can get a surge of adrenaline. We'll need to use the bathroom and our palms can get sweaty. So there's a whole lot of physiological things that can sort of kick off. The thing is, anxiety doesn't just pop up when we know something's about to happen, like we're about to give a webinar talk. Our mind actually also tries to anticipate danger, warning us about things that might happen or could happen in the future. Whilst that can be good sometimes, reminding us that the last time we ate a particular food, we broke out in a rash, so we probably shouldn't eat that again. But our mind can also be a bit like that overly helpful friend, the one who thinks they're saying and doing the right thing, but who isn't particularly helpful. When we experience saying something potentially threatening in our lives, our mind can very quickly set the alarm off, even when there's no imminent danger. It's like a fire alarm going off when all that's happened is that we've burnt the toast. We have thousands of thoughts a day. Some might be positive, some might be fairly neutral, and some might be negative. And what we tend to notice is that the negative ones seem to be more demanding of our attention. When we have these thoughts, they're often loud or repetitive. They feel like rules we should follow. They feel like they're almost like 100% true. And what we tend to do is we tend to believe them or accept them. We pay attention to them and listen to them. Our minds even have unhelpful ways. Our mind even has unhelpful ways of thinking, particularly at tough times. Some of these might be familiar to you. One is predicting the future. They're not going to hire me after that terrible interview. Mind reading. They think I'm overreacting. Catastrophizing, where we leap to the worst possible scenario. Shoulding and musting. I should be over this by now, or I must pull myself together. So just notice if any of these are creeping into your thoughts or your language, because they can impact on how you feel. Now, it's really easy to get hooked by our thoughts. When we get caught up in our thoughts, they can influence how we feel. How we feel can influence what we do, and our behaviours can influence what we think. So it can be a bit of a cycle. So for example, if we're out walking in the park and we hear a rustling in the bush, do we think, oh, it's a cat? Can feel pretty relaxed and carry on walking? Or, what's happening there? Or do we think, oh, there's a mugger, there's somebody there, feel quite frightened, and then look for somewhere to hide or feel safe? So as you can see, quite different patterns of thoughts, feelings, and behaviours, even for the same situation. An example with regarding to fear of recurrence might be, If you think you're going to get some bad news at the next doctor's appointment, you feel anxious and perhaps you decide not to go. As I mentioned, it's really easy to get hooked by our thoughts, often without realizing it. So in order to get some control back and not be pushed around by our thoughts, we first need to be aware of what our thoughts are. To simply notice your thoughts without judgment or without analysis. And I'm just going to play you a brief video by someone called Russ Harris, which demonstrates this really well.
So imagine that you're sitting in front of a sushi train at one of those Japanese restaurants. And there are all these dishes going past on the train. And in the center, there is the chef creating all of these dishes. The chef is like your mind, and the dishes are like all of those thoughts, ideas, memories that keep cropping up, coming and going all day long. Some of the dishes on that sushi train may be very appealing. Some of the stuff on that sushi train may be unappealing. And some of it may be neutral, and take it or leave it. And it's much the same with our thoughts, memories, ideas that pop up throughout the day. Some of them are very pleasant, we really like them, we want to hold on to them. Some of them are very unpleasant and we just want to turn away from them, get rid of them. And a lot of them are kind of neutral, they're neither positive nor negative. So all day long, the sushi chef of our mind is creating all these different dishes, and the train keeps carrying them round and round. These thoughts keep cropping up throughout the day. Now we can learn to step back and watch our thoughts coming and going in much the same way that we can step back and watch that sushi train. An unpleasant dish pops up on the train, we don't have to turn away in disgust and horror. A pleasant dish comes by, we don't have to reach over and grab it and stuff it down our mouth. And we can do the same with our own thoughts. We can step back with an attitude of openness and curiosity and watch them come and stay and go in their own good time.
So it can be helpful to just try and make some time each day just to sit quietly and just notice the thoughts that pop into your head. Be aware of your thoughts and see if you can just sort of step back and observe them. It's about learning to accept your thoughts for what they are, which is actually just thoughts, without getting caught up in them, reacting to them, or trying to get rid of them. One way we can do this is to say, I'm having the thought that. So for example, if we're having a thought, I can't do this, see what it feels like to say, I'm having the thought that I can't do this. It doesn't make the thought go away, but often people notice that the thought feels more distant and has less impact or less intensity to it. You can also use visual imagery. Such as putting thoughts on leaves on a stream or on clouds and just watching them drift off. The leaves on the stream activity, there actually are a number of audio recordings online if that's something that you're interested in exploring. Now we can't control whether we have a thought or not, and we can't get rid of thoughts no matter how hard we try. But we can choose whether we pay attention to the thought or not. How often have you had the TV on while you've been pottering around the house, but not really paid attention to what's being said? We can actually do the same with our thoughts. Sometimes I tell people that it actually can be helpful to think about thoughts like email. Some emails are useful and give us important information or help us get jobs done. Some emails are enjoyable or make us laugh, but the majority of emails are often what we would call junk. we can give the unhelpful thoughts in your mind just as much importance and attention as you give to junk email in your inbox. None. We can notice our thoughts and say, is this thought helpful right now? If the thing that we are thinking about is something that we have control over, then there might be some value in spending some time thinking about it. For example, seeking information, preparing or planning for something that's coming up. However, if the thing we are worrying about is out of our control, we can learn to simply notice the thought and then let it go. Another technique that is sometimes helpful is something called worry postponement. And again, it's not about trying to get rid of or suppress your thoughts. We know that the more we try and push something out of our mind, the more it comes back. Worry postponement is about noticing thoughts when they occur and deciding to return to them later at a particular time. So you might set aside 10 or 15 minutes later in the day, not just before bed, to think about any worries that have come up for you and to try and work through them. Are there things that you can do to address these worries? Do you need to talk to somebody? Is it about getting more information? Or is it practicing letting go of these worrying thoughts? When we have strong and difficult emotions, it's really natural for us to want to make them go away. We can spend a lot of time and energy trying not to feel them. And we may be able to do that briefly by distraction. What we find, though, is that they do inevitably come back, often worse than before. And while we're trying to push away our feelings or control them, that can actually get in the way of us doing things that we prefer to do. I like one of the metaphors that Russ Harris does in his work in acceptance and commitment therapy. And I'm just going to read it through to you. Suppose you love mountain climbing. It's something you're absolutely passionate about, and so one day you set out to climb this mountain that you've heard such great things about. But when you get close to the mountain, you discover that there's a swamp that runs all the way around it that no one's mentioned. Now, the only way you're going to get up that mountain is to wade through the swamp. You don't wallow in the swamp because you want to, but you choose to wade through it because climbing a mountain matters to you. So we can start to be with our emotions by first learning to observe them, naming them. Here's anxiety. Here's frustration. Noticing where they are in your body, noticing any sensations or tension, and making some room for them rather than struggling with them. That enables us to focus on other things that are important to us. Mindfulness is the ability to be fully present, aware of where we are and what we're doing, and not be overly reactive or overwhelmed by what's going on around us. You can engage in mindfulness in lots of different ways. You can do mindful eating. You can do mindful morning routines, whether it's brushing your teeth or while you're having a shower, or being mindful when you're doing things that you enjoy. When you're going for a walk in the bush, it might be noticing the color of the sky. It might be noticing how bright the leaves are, or noticing the gravel underneath your feet. There are many mindfulness courses out there, and there are a number of apps that are available that can guide you through how to do this. And just some of the ones that come to mind are Headspace, Calm, and Dare. So feel free to check those out. Another technique you can try is something called grounding. Now, grounding does for us what roots do for trees. They can keep us steady when we feel like we're being tossed around in a storm of thoughts and feelings. It can help bring you back to the present moment rather than thinking about the future. How you go about this grounding technique is to start off by taking 5 slow breaths, taking time to pause at the top each time, and just noticing your mind chattering away, but also looking around and noticing 5 things that you can see. Maybe it's a bird or a spot on the ceiling or a pencil on your desk. 4 things that you can touch. Maybe your clothing, your hands, the ground, the grass or a pillow. 3 things that you can hear. You might hear a clock ticking, a car go past, a dog bark, or you might hear your tummy rumbling. 2 things that you can smell. Now, this might not be easy if you're not in the right sort of environment. And if you can't automatically smell something, maybe go for a bit of a walk to find something. So you might go to your bathroom and smell the soap, or go outside and smell nature. And finally, 1 thing you can taste. What does the inside of your mouth taste like? Have you been chewing gum? Have you had a coffee or something you've had for lunch? Now you can do this activity as many times as you need to, just to help you settle and feel more grounded. Even though we have difficult thoughts and feelings, we still have control over what we do. Even though it feels like our thoughts and feelings are controlling us, get clear on what matters to you. What do you value? Write them down. It may help to group them into categories such as relationships, work or education, personal development, or leisure. Think about what it is you love to do. What activities can you lose yourself in? What do you believe in? What do you feel you can contribute? What means a lot to you? And then set yourself some small, doable goals based on what you value and commit to doing them. What can you do in the next hour, the next day, or the next week, or the next few months? Doing what matters can really give you a sense of purpose and enjoyment in life. I think don't be scared to make plans. It's important to have things to look forward to. But keep in mind that plans can need to change at any time for any reason. So have plans that can flex and bend as needed. And finally, I think self-compassion isn't something that comes naturally to a lot of us, and we can be quick to judge and criticize ourselves. Self-compassion is giving ourselves the same kindness and care that we'd give to a good friend. Acknowledge your feelings as being normal. Instead of trying to battle through with self-judgment, stop and tell yourself, actually, this is really tough right now. What can I do that makes me feel better? And how can I look after myself in this moment? Be proud of your strengths and your courage and acknowledge your achievements, no matter how small they might feel. Someone who does a lot of work around self-compassion is Dr. Kirsten Neff, and she has a website with a whole lot of techniques around self-compassion that you may want to check out. So I'll just put the link there. When can it be helpful to seek additional support? I think the key things to be aware of, if you find yourself really preoccupied with cancer recurrence and that it's impacting on your ability to function day to day, it's worth finding somebody that you can sort of talk with about this. Also, if you or family members have any concerns about safety, there are a number of things that you may notice. You might have trouble eating or sleeping well. You might notice changes in your mood or anxiety or your level of irritability. If you're feeling hopeless about the future, or you're stopping doing things that you used to enjoy, or you're stopping planning for the future or making any big decisions. If you're limiting contact with others, you're having difficulty concentrating or making decisions or being forgetful, whether it's impacting on your relationships with others or what you do in avoiding attending follow-up appointments or frequent body checking or high levels of reassurance checking. So who can you reach out to? So Leukemia Blood Cancer New Zealand are a great organisation, and I would encourage you to touch base with them about what supports are available. Also through the Cancer Society, many of the branches do have access to counsellors or nurses. You may be able to access counselling through your GP, so that's worth checking out. If you have a new diagnosis or are having treatment through the public hospital, you may be able to access the cancer support services through Te Whatu Ora, so they are spread around the country. You can also look at accessing private counsellors or psychologists. And again, if there are any concerns about safety or wellbeing, contacting Te Haika. It's a service when there are any particular concerns about how people are coping. Okay, well, that was a very quick whip round today, and I've just put some references up there from some of the information that I spoke to you about. And so, yeah, happy to answer any questions that anybody might have.
Lovely, thanks so much, Philippa. And I guess, you know, it's comforting for those that are struggling with the fears here, that it's, you know, I guess nice to know that it is quite common and it happens to a lot of people, and to have heard so many practical steps today from you of how to manage that. So this is the time where we do move to the questions and answers. We've got some questions here, and if you're at home and you've got a few more questions you want to send in, you're most welcome to do so. Just hit that Q&A tab at the bottom and type it in. Our first question today, Philippa, is worry postponement. Why does a fear that you are not aware of during the day pop up during the night and affect your sleep?
Oh, that's a really good question. And I think it's something that a lot of people experience. They might feel like day to day, actually during the day, things are going relatively okay. And often that's because there are other things that are capturing your attention. You know, it might be you're busy focusing on work, or there are children you're having to care for, or there are other things that you're having to do. At nighttime, however, there's not a lot of other things to be focused on. So what happens is we naturally, when we're asleep, we go through periods of being really deep sleepers and light sleepers. And often we might wake up in that really light phase of our sleep. And because there's not a lot of other things to focus on, our brain is really good at going, hey, think about this, hey, think about this. And often it's those things that are worrying us or popping up. Yeah.
Thank you. Earlier on, you mentioned about progressive muscle relaxation. Can you explain a bit more what that is?
Sure. And I'm happy to send a copy of an example of it through to Nikki if anybody wants a copy, but you can also access them online. Progressive muscle relaxation is a process where you systematically tense and relax parts of your body. So you might start at your feet and go up to your head, or you can start from the top down. And so you, first of all, check that you haven't got any particular injuries or things. We don't want to do any harm to you. But the idea is that you tense those muscles for a few seconds until you get those a little bit of a shake going on, and then just let them relax and go floppy. And so what you do is you systematically go through the top of your head, through your face, you know, pull all those scrunchy facial expressions, your shoulders, your arms, your abs, you know, all those muscles. And people find that that can be quite helpful, particularly if you notice that you're someone who gets quite tense at times.
Great, thank you. Another question here. With a rare disease type, and have been told by lead doctors that tumours will return, how can I make the most of my current remission when I don't know if I have months or years?
Yeah, it can be really difficult when you don't know what lies ahead in terms of your time. So, and it can be really easy for that to really dominate and to actually become a bit of a focus. And I imagine that's not how you'd like things to be day to day. So actually being able to think of, okay, well, day to day, what are the things that really matter to me? What's important? How can I do something that is important to me each day? You know, doing activities that can help you focus on the here and now, rather than what our mind likes to do, which is leap into the future. Yeah, good question.
What can we do to ease the worry and anxiety of others, such as your parents and children, if so much as a sneeze they worry it's cancer?
Yeah, well, as I mentioned, even family members can experience high levels of fear of recurrence. Look, it can, everybody's different in terms of how they manage stress and anxiety. I don't know whether there's opportunities for them to come along to any of your appointments. That may or may not be something you wish to happen, because sometimes it can help to hear it from someone else. It may be that if there are tips or strategies that you find helpful, being able to share those with your family members. And I'd also encourage family members to touch base with Leukemia Blood Cancer New Zealand or Cancer Society about supports that can be available for family members.
Right, thanks, Philippa. And similar with the family, but on the other side is that question here is, I get really annoyed when families say be positive. It's hard to ignore the fact that I've been told it's likely to return. What should I say to them?
Yeah, it's actually really hard, because often family members go, oh yeah, you've got through treatment, everything's going to suddenly get back to normal. And actually, that's not the reality. There's a lot of things that you have to deal with afterwards. And I think figuring out how to best communicate with family members isn't easy. Sometimes it can be helpful to actually have a think about before you meet someone, or if they're not around, thinking, well, what is it actually I'd like to say to them, and in a way that's in keeping with who you are, and actually prepare a little bit of a script for yourself, and you can run through it going, okay, well, if someone says this, or if someone says this, this is actually going to be my response. So it can be good to just give some time to thinking about, okay, well, what would I like to say? How would I like to say it? And as you said, the sense of, oh, it's all going to, everything's going to be fine. Actually, it's important then to realize that actually there's lots of things that can continue to be challenging for you.
Thank you there. Look, and it looks like we've got our last question here, which is, I struggle with mindfulness. Any tips with how to start and how to get into that?
Yeah, and look, everybody's different in whether they find mindfulness helpful or whether they find it easy. And some people do really struggle to sort of be aware. And I think one of the first things can be is just find yourself a quiet spot sometime and just close your eyes if you feel comfortable doing that, and just sit there for a moment, just noticing. What sort of things pop up? Often when I do this with clients, their minds suddenly go blank, and that's okay. What will happen is your mind will kick in. That's just how it works. So it can take some time, just simply about just noticing what comes up. Sometimes people find it helpful to imagine their thoughts coming up on a TV screen. It may be that you might want to try that grounding exercise of just noticing what's going on around you. What can you hear, touch, taste, see, and smell? So mindfulness is around, what can I do to help me be present in what's going on? How can I sort of be aware of what I'm thinking, but also about what's happening around me? Trying different things in different ways is helpful. Again, it can take some practice.
Yeah, thanks, Philippa. Look, there's a couple more have come through, so I hope you don't mind a few more questions.
That's okay, sure.
Do you have any recommendations, from a psychology point of view in coping with fatigue? I used to do so much more, but now I don't have the energy to do as much, and it can get me down.
Yeah. I think in terms of physical things, fatigue is probably one of the biggest things that people find difficult with, whether it's because of treatment or it's just generally, where they're at, and particularly if they're struggling with mood and things like that, fatigue can also be a big challenge. I think the key thing is that you know your body better than anybody else. So it's really important. One of the things that can be about pacing yourself, often I've talked to people where they've gone, oh, I've been feeling good, and so I went out and I did this and I did this, and then the next day they were absolutely wiped out. So it can be about knowing, okay, what can I do each day that makes things manageable, that doesn't make me too exhausted the next day. And sometimes, noticing, is that thought around fatigue because I am actually absolutely fatigued, or is that I'm just struggling to be motivated sometimes, because that can also make things challenging as well. But fatigue can be a big challenge for people. And, again, looking at, I can't think of anything off the top of my head, but I do know that there are strategies out there for people who are struggling with fatigue.
Thanks, Philippa. And one here, what's the best way to work through recurring symptoms that are similar to hormonal changes, yet are the same as previous cancer? And I guess you've given us a lot of different strategies today, but is there one that you think would be perhaps the most useful in that situation?
I might get you to repeat that one, Nikki, just so I can get my...
Well, it's probably a mix of a medical question and a psychology question.
Okay.
So what's the best way to work through recurring symptoms that are similar to hormonal changes, yet are the same as previous to cancer diagnosis? So I guess what they're asking there is, when you're feeling things happening that are perhaps just a normal hormonal change, that they were similar to what they went through when they got the cancer diagnosis, and they're worried that is this the cancer coming back, and it's probably just the hormonal.
Look, I always say, look, if you're in the first instance, if you are concerned, always have a check back with your medical team, have a chat with your doctor or GP, just to check things out. If you notice that actually the symptoms that come up are consistent with your hormonal responses, it can be about if it's something that's been happening for a while and you've had it checked out with the doctor, just sort of noticing the thoughts, because often we have recurring thoughts that sort of have a bit of a theme to them. Oh, there's that thought again. Oh, it's popping up again. There's that worry. And just looking at, okay, what are ways that I can let that thought go if I know that I've had it checked out and I know it might be linked in with some anxiety. Giving that a go.
Great answer, thank you. This is an interesting question. I struggle to identify how I feel. How can I improve this?
And a lot of people do find that not an easy thing to sort of be able to notice how I feel. Often tapping into what you notice in your body. What's happening in, is my breathing changes? Is my heart starting to increase? Some of those physiological things that I talked about in terms of that fight-flight response. Sometimes it can be helpful to get feedback from other people if they notice that you're feeling a bit anxious or you're feeling a bit low, getting them to sort of give you the heads up if it's not something that you find easily to identify.
Lovely, thanks, Philippa. And this is our last question. So you talk of the importance of social contact, but what do you do if the things you have done in the past no longer feel safe now that you're immune compromised, especially with COVID? So the strategies you used to have aren't available.
And that's a really difficult thing. And I mean, particularly now with this shift from more mask wearing, I think it's really understandable and natural for people who are immunocompromised to have heightened anxiety about going out into social situations. And so sort of it's finding that balance between being able to have that contact, but also feeling safe and looking after yourself. So it might be that there's other ways you can catch up with people. It might be that you catch up outside where you can have more distance, or it might be that you catch up over Zoom, or it might be that you continue to wear a mask. And I think there are going to be a lot of people out there who continue to do that just so they feel more safe about their health. But I think it is a big concern for many people who don't feel safe getting back out there in the community because of the possible risk.
Thank you so much, Philippa, for your wonderful presentation today and for all the answers. I know it's sometimes hard to do that on the fly. You've given some wonderful feedback today, and we really appreciate your time, your knowledge and your insights. And for our viewers today, talking about this can be confronting and unsettling. And if you're struggling, please reach out to your local support coordinator. We'd be very happy to talk to you and support you further. And finally, a reminder that our session next week is on mindfulness, compassion and mindset change with psychologist Sean Bowler. Look forward to being with you again. And thanks so much for your time today. Kia ora, goodbye.